Hi, it's Dr. Bonnie here at Anushka Cosmedical Centre here in the Palm Beaches, Florida. And I want to talk to you about my latest blog, which is about the PDO Thread Lift. PDO means polydioxanone, an absorbable thread that's been around for decades. And we use that to help realign skin and just kind of alter a few things. But there's a lot of controversy about it, and there's a lot of kind of myths about it, but I just wanted to clear up some of those little myths and controversies that are out there. It's a very safe procedure in the right hands, and there really is very little that can happen. Now, the first thing you might hear about is for a side effect is pain. So somebody like me doesn't want to experience pain or give it to anybody else, so I end up numbing both at the portholes where the cannula goes in and all the areas that we are going to be pushing the threads into. So all you feel is a bit of pressure, nothing more than that. It's just really pretty darn easy to do that. And minor bruising is also something that is possible, but whenever you're going to inject something into somebody, a bruise is always possible, but often because I use a little bit of epi in my lidocaine, I don't get bruising, but it is possible to get that. Also out there is the snapping of threads. Years ago, we had threads from Korea and different places, and some of those threads, especially depending upon how long they were manufactured, how long ago they were manufactured, they would break, and that did happen. But in the last 5 years, I've only used Nova threads, which are manufactured in the United States, actually down here in Florida, and I've not had a breakage in over 5 years, and there's a variety of types to use there, so that's a really good thing. So there's another thing called dimpling, or actually seeing the thread. I've never seen the thread on anybody, but I have seen dimpling on people once in a while, and what that means is the person who inserted it was too superficial. They're not supposed to be in the dermis, and it's not supposed to grab onto the dermis. It's supposed to be in the subcutaneous tissue, so it's just a little bit deeper than what the person probably put it in. So you can mitigate that by kind of a nice massage, or you can pull it out and insert a different one a little bit deeper, and then you shouldn't have it at all. There's parotid gland injury. The parotid gland is your salivary gland. And what happens sometimes is if somebody wants to insert a thread, say from here down to here, they might be too deep and actually hit that gland. The gland is like right here and a little bit here. And you're too deep for that, but this is not a great vector anyway. There's nothing that's going to be achieved too much by putting a thread from here to here. So we tend to go a little bit more anterior and place the threads that way. And then you can get a nice pullback, and then along the jawline you kind of pull back, but you're in the subcutaneous tissue, so you're not going to hit the masseter muscle, or you're not going to hit the parotid gland. So that shouldn't be happening, but if it has, the threads are absorbable, and whatever has happened with that will dissipate in a very short time. Infection. This is considered a clean procedure. So that means that as long as everything's clean, it should be okay. The patient's all cleaned up. We've got the hair back. You're doing, everything you can. But I think that if you use sterile gloves, use a sterile field, you're going to be a little bit safer even. And so I do that. But infection is very rare, and it shouldn't happen. If somebody needs an antibiotic, maybe just kind of assess how that thread was put in and what the area around the person was. So we want to make sure that everything is very sterile. And any questions, just give us a call at 561-820-8055. The thread procedure is quite easy, and right now we have a special. If you want to buy 6 threads, and 6 to 10 is kind of an average, then you're going to get 50% off a filler. And often we just need a little bit of adjunct to the thread lift. Thank you.